Hello everyone, good afternoon. I am Geet from the Bladder Wellness team. Today we will be discussing on a very important topic which is overactive bladder. Overactive bladder, also called as OAB, is a condition of the bladder which causes sudden need to urinate that may be difficult to control. OAB increases with the age. This condition is a common and distressing condition which may have a large impact on the quality of life of the patients. A doctor such as urologist can treat this condition and help the patient get relief. To educate us more on OAB, its diagnosis, its treatment and prevention, we have with us Dr. Saurabh Kumar Arya from Meerut, Uttar Pradesh. Dr. Saurabh Kumar Arya MBBS, MS and DRNB Urology is a consultant urologist at Lokpriya Hospital in Meerut. His expertise lies in kidney transplant surgeon and has also been with kidney and urological issues including cancer and solving it vividly. He has a rich experience in the field of urology and has performed various critical surgeries and treated his patients with utmost care. So let us hear and understand more on OAB from Dr. Saurabh. So welcome on board.
Thank you, Geet. Uh, basically, OAB is overactive bladder. So,
Right.
in this session, basically, I will be just explaining because it is for patient awareness. So, I will explain all the technical terms in a easier way, the simplest way possible, and uh, I will use both the languages like Hindi and English. Okay, I will
Sure.
use the mix. So, uh, about the OAB, that is overactive bladder, it is a, if we go by definition, so it is a symptom complex of urgency, frequency, nocturia, with or without urgency, incontinence, in the absence of UTI, that is urinary tract infection, and other obvious pathology. Other obvious pathologies are like systemic diseases like diabetes, neurological conditions, brain strokes, means that is CVA, cardiovascular accidents, Parkinson's disease, or some bladder stone, or may tumor. The tumor may present also like the symptoms of OAB and tuberculosis. So
Right.
basic, basically, overactive bladder, it is a symptoms which patients complains of, means that urological complaints uh, with uh, with which patients comes to us. Okay, so it is urgency. Patient complains of urgency. So what is urgency? Urgency is urgent and sudden desire to micturate that cannot be deferred, and there is fear of leaking of urine in his or her clothes. So means patient is not able to control his urine, and there is also frequency, means frequency, if we define uh, that it is increased number of times for micturition. Micturition is urination in simple terms. So यूरिन पेशेंट को बार बार जाना पड़ता है यूरिन के लिए, एंड
Right.
इट इज डे टाइम एंड नाइट टाइम frequency. So it if it occurs in during the sleep time, so it is called nocturia. Okay,
Okay.
and it may be associated with urge incontinence. Means if urgency is associated with definite leakage of urine in clothes, it is called incontinence. That is inability to control the urine. Okay, so it is about the definition and other the definition part. If I explain it further, means it contains also that we have to rule out other obvious pathologies that I have already mentioned earlier, like
Right.
diabetes. So we have to evaluate that if there is no obvious pathology, then we can label a patient to be having overactive bladder.
Right. So, sir, I also mentioned in my introduction that overactive bladder and its meaning, and you also have briefly described that what exactly is this condition. But, sir, my next question to you would be why this overactive bladder occurs? What is the reason behind it? Does it only occurrence is due to the age factor, or what all other factors responsible for it?
Okay. Basically, it is multifactorial. Means there are multiple factors. We can't assign a single factor or risk factor that causes this disease. Okay. So, for understanding the etiology, means that is the reason for this disease, we have to understand the uh, basic physiology, that is called, means that is how we urinate. Okay. So we have to understand this. If we understand this, then we can find the cause of the disease. Okay.
Right.
So basically, we have two kidneys. You know, all humans, they have two kidneys. Kidneys, they produce urine, and that urine comes through the uh, two narrow tubes that are called ureters, and urine that accumulated, means that is stored in bladder, urinary bladder. So when uh, so normally, if in bladder, urinary bladder, there is around, is more than 100 ml urine is there. So patient gets, or human, we get a sensation of micturition, that there is something in the bladder. Okay, normally it happens, and when that sensation goes to the brain, and in the brain there is a center that called pontine micturition center. Micturition control करने के लिए सेंटर होता है ब्रेन के अंदर, जो इसको कोऑर्डिनेट, इसको रिसीव करता है, और उसको सेंसेशन को, जो सेंसेशन आपके ब्लैडर ने सेंड किया है उसको रिसीव करता है, और रिसीव करने के बाद वो उसी के अकॉर्डिंग एक्ट करता है। तो हमारा जो हायर, इसके भी ऊपर एक ब्रेन में सेंटर्स होते हैं जो हम कंट्रोल कर सकते हैं। बेसिकली नॉर्मली अडल्ट हम अपने मिक्चुरेशन को थोड़ा डिले कर सकते हैं, तो वो हायर सेंटर्स की वजह से होता है, जो कि पोंटाइन मिक्चुरेशन सेंटर के थ्रू होता है। फिर वो सेंटर आप ब्लैडर के मसल्स में सिग्नल भेजता है, और वो सेंसेशन के बाद फिर हम मिक्चुरेट कर सकते हैं। तो बेसिकली ये जो तीन सेंटर्स हैं, जो तीन पॉइंट्स बताए मैंने, ये जो ट्रायड है, इसको जो भी चीज अफेक्ट करेगी, वो चीज ओएबी के लिए कॉज रहेगा। तो इसमें जो मेन है फैक्टर, वो एज है। इसीलिए ओएबी एल्डरली में ज्यादा होता है, दूसरा फीमेल्स में ज्यादा होता है। तो basically age is a factor, that is a non-modifiable factor, but age is definitely a factor for OAB. And other causes like psychological factors are there. Means if a patient is suffering from stress, anxiety, or depression, so these patients also get OAB. Third, we can say that is a metabolic syndrome. Metabolic syndrome is means it's a common. It's also syndrome. Syndrome is also complex. Is a complex of some symptoms. Means some diseases. So it comprises of diabetes, obesity, and dyslipidemia. Dyslipidemia means uh, having higher cholesterol levels. Okay,
Yeah.
so those patients also, they can get OAB.
Okay. सो सर, हमने जैसे कि कॉजेज के बारे में बात करी, मल्टीपल कॉजेज हैं एंड यू सेड दैट इट इज अ मल्टी फैक्टोरियल थिंग व्हिच डेफिनेटली वेयर एज इज अ मैटर। सो सर, क्या कॉमन सिम्टम्स देखने को मिलते हैं ओएबी को? क्योंकि काफी सारे लोगों को लगता है द ओनली अर्ज टू यूरिनेट, और मे बी समटाइम्स दे कंफ्यूज इट विद द यूटीआई। सो इज इट सिमिलर, और लाइक व्हाट आर द मेजर सिम्टम्स ऑफ दैट?
Basically, symptoms are, means, which I have already explained in definition. So, it when a patient means, there are symptoms like urgency, urgent incontinence, and frequency and nocturia. So these symptoms are common in other diseases also. So it is the means, it is up to the expert, means, for that urologist evaluates a patient, and with that we can define that patient is having overactive bladder or not. But my message to the all the patients is that if they are having these kind of complaints, like urinary complaints that I would explain, urgency, and they have frequency nocturia, they should consult a urologist, and he will evaluate it in that form, and can diagnose if it is OAB and manage accordingly.
Definitely, sir. And as we were speaking about diagnosis and multiple treatment options, so sir, what are the treatment options involved in OAB, which is overactive bladder?
Okay. Basically, uh, it comes in evaluation of the patients when we prescribe them bladder diaries. So there is a role of bladder diaries in OAB. In this patient, that is a simple diary. Bladder diary means we give a chart form, and patient there get notes down when he voids and at what time, what the volume is, how much is the intake of water, and how much he or she is leaking. So he charts on these bladder diaries. After that, means that diary has a role like uh, the subjective symptoms of the patient. We can objectify it. Okay, so we I can evaluate means how the severe symptoms are there, and means and this bladder diaries helps us say to evaluate the means what is the effect of our treatment in management part also. Diaries they are effective.
Hmm.
Then in treatment basically there are some behavioral treatments also for overactive bladder. Means behavioral treatment means in simple form it is lifestyle changes.
Okay.
Okay, so the first lifestyle change is like we can restrict the fluid, means intake of the patient. That helps a bit. In means I explain it that if we restrict night time or evening time, late evening time fluid intake, so the patient gets less of nocturia, so he can sleep or he or she can sleep well in night. Okay, and next change a patient can do like he can restrict his caffeine intake. Caffeine is present in mainly in tea, coffee,
Yeah.
and so these are bladder irritants. So bladder irritants they that aggravate the symptoms of OAB. So in the
Okay.
initial stages, if person is suffering from OAB and these are the symptoms, and we have diagnosed that patient is having OAB, so I prescribe means I just prescribe these kind of changes.
Yeah.
Okay, so uh, other than that, we can advise for weight reduction. That also helps. Weight overweight or obese patients they are more worried, the symptoms that uh, aggravated more. So weight reduction also helps, and avoiding of bladder irritants like spicy foods. So I advise my patients to avoid that spicy foods or tomato products or some citrus foods also that aggravate these OAB symptoms. So avoiding these can help the patient, and these are non-medical treatments. So patient can do these things on home basis. These are home remedies.
Right.
Okay. Then other specific like urge suppression exercises. There are some exercises. From these exercises, the patient can get help like urge suppression exercises are there. Urge suppression, I will explain in detail. Like if patient is having is means there is sudden desire to micturate. So I advise my patient that because that urge is it in a well shaped. Well shaped is like urge started, then it reaches a peak slowly, and after reaching a peak it will decrease. So if I advise my patient that then he has to just hold on for few minutes, few seconds, and he has to try. Means from this, the exercise like the scientific basis is like when they suppresses their urge, though, so they are training their brain to control that urge. So in the with this practice in the long term, that it can be cured, and they will further not they will not be needing any medicine for that. Okay, so this is definitely means I have tried in many of my patients, and they have getting benefited. And the other exercise is like pelvic floor exercise. Like pelvic floor exercise, they are very popular and they are means they are very means available or online
Yeah.
pelvic floor exercises. There are different methods to do pelvic floor training or exercises. So if a patient trains their pelvic floor muscles, so that also helps the patient in symptoms of OAB.
Definitely. So you very briefly explained us about even the home remedies, what exactly should be done at home, not just the multiple treatment options which we have, but there are phenomenal things like you mentioned, keep yourself hydrated, avoid citrus fruits, and so on. So, which brings me to my next question to you, sir, that weight and diet also has a major role in OAB, right? That they can aggravate the issue. So, sir, what do you think? People generally do a lot of home remedies and these stuff and
Yeah,
still go to a urologist if they feel the problem. So, what should be the right time to visit the urologist after trying everything at
no, actually, I will not advise my patient that they should try everything
home?
and then they should come to visit a urologist. That
Yeah,
is not a proper approach. Basically, because it is the symptoms in OAB are so overlapping that we can't means patient himself can't diagnose the disease. Okay,
okay.
and as I mentioned that the symptoms may be because of diabetes, uncontrolled diabetes, maybe because of neurological conditions like brain strokes, means they are after brain strokes or CVA, or maybe he is suffering from Parkinson's disease. If he or she now patient is they are doing only the home remedies, they will not be get cured, and other that serious conditions like I also mentioned bladder tumor also have these kind of things, and if they have that bladder tumors and they don't get diagnosed, then these conditions may aggravate. So it is not a so this is for patient awareness, but
Yeah,
they should take the home remedies also means way after visiting the expert on.
right.
So
And on the day-to-day basis, like these are the things which they can take care of themselves, like
yeah,
definitely.
yeah, yeah, yeah.
So, sir, many people have this myth about OAB that it cannot be prevented. So, as an expert, I want to ask you that can OAB as a problem can be prevented?
In strict term, if we say that what is prevention, prevention is before before the disease happens.
Yeah.
But in this case, there are symptoms. So we can obviously preventing with this home remedies or the conservative treatment. I have also mentioned. I have already mentioned in previously. So
Mm.
with these measures, then it can be prevented. Means it is not the in the strict term, but it can be controlled. The symptoms can be controlled.
Mm.
Okay, but before that means the reason for this disease is age, means increasing age. That is a non-modifiable factor. So in the strict term, it can't be prevented, but it can be controlled if the symptoms are there. So with the measures, we can control the symptoms, and if we control the symptoms in initial phase, that is better. If those
Yes.
symptoms get aggravated, then these symptoms or the disease that uh, got complex, and then there's problem
Yeah,
because
100%.
okay, and
Definitely.
these are the first line management. You asked about we are discussing about the management. So these are first line management, and there are some medicines also. Means uh, with these precautions, we advise patients our patients medicines also. So they are wonderful medicines available that can control the symptoms, and like there are some anti-muscarinic drugs. They are called that is the group. So they can control the symptoms. And recently we have also updated these medicines. The latest they have so drug called Mirabegron that also controls the symptoms. Otherwise, then is the second line drug. The second line management is called. Then we have to if the symptoms are not controlled with the second line management. Then we have to shift to third line management. And the third line, we have to give some botulinum toxin, the Botox injections are there, so we have to give him in the bladder. So botulinum toxins that also controls these symptoms, or these are management of the third line management of OAB. And apart from that, there are neuromodulation also. We can modulate the nerves that are supplying the bladder, and for that, that is needed very rarely. Means that what I was saying, that the 80-90% of the patients that can be cured with the conservative management and medicines only. The botulinum toxin or these neuromodulations are rarely required. And in OAB, the last choice is surgery also. That is also rarely required.
Definitely, sir. And this is a line of management on the first level basis, second, third, as you explained. I hope this gives wide information to all our viewers and help them treat this condition better. So, you mentioned that it is more seen in women and there is a ratio of men and women. So, sir, why is the reason of the same that we see OAB more in women? Is there any specific reason or is due to hormones like what?
Basically, uh, there are some diseases that happens more in females, but in my view, what my knowledge says, that uh, these uh, these symptoms, this OAB disease, is also associated with hormonal status. So some of the women, they, after menopause, okay, the estrogen status, the estrogen level goes down. So, and after hysterectomy also, I have seen that many of my patients after hysterectomy, I have diagnosed them to be having OAB. So, yeah, in women, that's because of these hormonal status or some uh, like post hysterectomy. Okay, so this may be the cause, but
Right.
it is the association only. We have not find any causative factor to this disease.
Okay. And sir, if we come back to OAB, discussing it in terms of diet, so you very clearly mentioned that there are some fruits and some things which can be avoided, but diet can also play a vital role if we speak about diet and people who are obese, who are overweight. So our viewers have also multiple questions today. One of the viewers, Rahul, is asking, can weight loss help manage OAB? Which was my next question to you as well, that can a weight loss journey help to reduce OAV as a problem, and does weight has something to do with it?
Yeah, yeah. Weight is definitely a risk factor. I've already included in my talk also that weight, if with the weight reduction and diet, means diet in term of reducing the weight, and some of the uh, dietary factors that irritate the bladder, like citrus fruits and spicy foods, that also definitely helps.
Definitely, sir. Thank you so much for us answering that. Ayush from our viewers has the next question. Are there certain foods or drinks that can worsen OAB symptoms?
Yeah, alcohol that
Yeah.
will worsen the symptoms, tea, coffee, that will and these are the drinks, beverages, drinks, the high contain sugar containing drugs, beverages, that cold drinks, that will aggravate the symptoms.
Yeah, and I hope, sir, alcohol and smoking both can lead to stress and then definitely psychological imbalances, which may be a direct cause of OAB or how dysfunctions.
You're right. Uh, Smoking indirectly can affect in that
Yeah,
way.
yeah.
Okay.
And Arun Pal from our viewers are asking the next question. How can I manage OAB when traveling or going out for extended periods? Yes, sir, definitely when people have to sit at maybe their offices or they have to work throughout the day. And if they're suffering from OAB, so how do they manage that?
Okay. Basically, if someone is going by train, or if someone doesn't have any access to toilets, so that time he can reduce the fluid intake. That will help, and with medicine will also help. So If you ask me a home remedy, so home remedy is fluid restrictions, and some taking some medicines on that journey that will help the patient.
Yeah. Okay. So during the time whenever they are traveling and if they're sitting at long hours, some medicines or so can help them manage it better and relieve their issue. And so during the night, how to take care of the problem.
This is a similar situation. Means if there is nighttime frequency, the main symptom is nighttime frequency, and the patient is diagnosed to be OAB, then he can restrict or he or she can restrict nighttime fluid. Means after taking dinner, he or she can avoid drinking too much of water. That will help the patient, and obviously. Every time only fluid restriction because uh, if a patient goes for this therapy that I am only restricting fluid, so there will be dehydration. After
Yes.
dehydration, there were more chances of urinary tract infection and other issues. There are more chances of urinary stones. So restricting of fluid is not a treatment. But if you ask me for temporary, I want to just relieve these symptoms, then and that time I can advise. Otherwise, restricting the fluid is not the
Yes.
restricting the fluid is not any solution of to the problem, but the symptoms can be relieved if
Okay.
he's taking small amount of intake water on.
Definitely, sir. Kaushik from our viewers is asking our next question, sir, to you that can UTI or any other infection can cause overactive bladder? Is it the reason or there is a direct correlation between the two?
Basically, if patient is suffering from UTI, so there is infection. So that is a different disease. Not it is not OA.
Yeah,
I have already explained that these things that UTI that needs to be ruled out before labeling a patient to be OAB. So OAB is a disease after we have diagnosed it. Okay, so if it is UTI, we have to give him antibiotics. The management is basically different,
yeah.
and management of OAB is different.
Correct. So, Kaushik, this answers your question that there is a visual difference between the two, even in the symptoms. I believe there is a difference, and UTI can be treated with the antibiotics. And so, going to the next question, Priyam is asking from our viewers, sir, that is OAB a permanent condition or can it go away with time or over time?
Uh, Basically, we can't say it is a permanent condition, but the risk factors that I mentioned, if we control these things or with the medicines, we can means just mentioned that exercises, brain train, that is urge suppression exercises that trace the brain. So some of the patients with over time, I have seen that I have cured the patients also. It is not a permanent thing, but it is not a thing like it is not like a infection only that we give him and or we give a patient antibiotics and he is treated in 7 or 10 days. It is a some long-term treatment is there, and they have to definitely train their means brain with continuous exercises. So it is not a permanent or incurable disease, but it can be managed.
Okay, definitely, sir. Next question from Ankan from our viewers is asking, what is the reason for chronic prostatitis for young men? Is there no permanent relief?
Chronic prostatitis for
Young men, and is there no permanent relief?
okay. Basically, this is a different entity. This is a different disease. But for the sake of our viewer, if there is chronic prostatitis, is means there's a term explain itself that it is a long-term prostate infection. That's a
Okay,
different thing. That is a different thing. But the thing is that we have to that infection in the prostate that takes long time to cure. So
yeah,
you have to. and there are some antibiotics that reaches the very few antibiotics that reaches the prostate. So there is delay in, means if we consider only the UTI. In the UTI, there is a UTI is a broader term, and that come in passes in that umbrella. There is a chronic prostatitis. There is a disease that comes in UTI only, but UTI uh, of that prostate, that takes some longer time to cure,
Okay.
but it is a curable disease.
Definitely. So, sir, any cases which you want to discuss, any example which you want to discuss or share with our viewers as a message to all of them? And before we wrap up, I would request you to give a take-home away message to all our viewers who have been joining us today to manage OAB better and to get to their urologist faster if they see any such symptoms and they treat it well.
Okay, so in the summary, if I say that if patients they are having some urinary complaints, okay, so mostly our means some women mostly, they don't go to a doctor to visit. They just suffer, and they because of embarrassment, because they are leaking of urine in their clothes. They because of embarrassment, they don't visit a doctor or a specialist, urologist for this disease. So I just advise my patients to just visit a urologist for these symptoms. And after visiting, if your urologist declare that you are having this condition or OAB, they will advise treatment. And these are all which I have already explained, that they are home remedies also. And there are some precautions, not only medicines, but with the help of medicine and these precautions, that disease is curable. So the first thing is to visit expert.
Definitely. Do visit your urologist on time. And as sir mentioned, there are multiple home remedies also just to take care of yourself in a better way, in a more prominent way before visiting the urologist. And definitely, if the symptoms are there and if you're feeling any discomfort, then do get to your urologist in time. Thank you so much, Dr. Saurabh, for your valuable time. It was quite an informative session for our viewers. We look forward for many more such awareness sessions in the coming time. And thank you to all our viewers also for the excellent participation. For
Thank
more
you. Thank you.
information and updates, stay connected on our Facebook page, Bladder Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you, sir. Thank you once again for being so patient and describing each thing to our viewers in such wonderful format.